Hello, ladies and gentlemen. My name is Dr. Kalitenko, and today we are going to talk about heart failure and supplements and minerals that might give you support you need to fight this very kind of dangerous problem. As you know, heart failure is a condition when heart cannot push the blood into your vessels appropriately. It creates a problem because circulation is impaired, and obviously if there is not enough blood going to your all your parts of your body, it creates a problem with muscles, with liver, with kidney, brain, etc., etc. Fighting heart failure is extremely important, and what I would suggest is to first make sure that medications you might be taking do not do any harm to you. And what I'm talking about, medications like statins or beta blockers, sometimes they're given patients with heart failure. They might create a problem in terms of they were linked to blocking production of coenzyme Q10. And as you very well know, that CoQ10 is necessary for energy production. So some if there is a problem with the manufacturing of CoQ10 in your body, it might create a problem with energy production. If you don't have energy production, obviously that your heart muscles cannot work properly, cannot push the blood into your vessels. So basically, what I'm driving at that if somebody with heart failure, whether he is taking or not taking beta blockers or statins or some other drugs that might impair CoQ10 production, he needs to take coenzyme Q10 about 50 to 100 milligrams daily to give himself a support. He needs to fight with heart failure. Basically, what CoQ10 does, it supports your energy production, the supportive role. That's what we want to support. Besides coenzyme Q10, what else may be beneficial for you is magnesium. Magnesium is extremely important for our body. Some people believe that about magnesium has about 200 functions in our body, and obviously for the muscle contraction you need calcium, you need magnesium, and it's very important also for heart stability because magnesium is intracellular ion. It is in the cells. Most of calcium, magnesium is in the cells. So you need to make sure that you have it enough, because if you don't, it might create an instability in terms of charge of your cell, and it can create a problem stability of the rhythm. So if somebody has heart failure, he wants to function his heart properly. And what important part is that first his atria have to contract first, and then ventricles contract, because atria gives your heart like a kick, which is very important. So if somebody has a problem with that, and his rhythm is heart rhythm is irregular, supposedly somebody has an atrial fibrillation, which might be linked to magnesium deficiency or at least precipitated, or then he has a problem because of this absence of that kick. His heart is failing just because it's not the sinus rhythm which he is supposed to have, but it's because of the regular heartbeats that can create a problem because of lack of electrolytes like potassium, magnesium, etc., etc. So this part is extremely important, and in terms of also energy production as well as maintaining proper level of magnesium, we need to mention B complex, B1, especially B6. And in my understanding, everything is important: B1, B2, B3, B6, B12, because you need to make sure that all chain of energy production is intact, and that's what we want to have, especially in patients with heart failure. Why? Because in heart failure sometimes your digestive system may not be working properly because having too much water, like kidney, like liver can create a problem because it can accumulate water. That's why we want to make sure that all the vitamins are on board. Also, I want to mention two more, is L-carnitine and vitamin D. Why are they important? Because they're important for the overall cardiovascular health. and it's even ischemia can cause precipitate heart failure. So we want to make sure that we have on board everything possible to give you support you need to improve your cardiovascular health. So, but the bottom line is simple. So first, what I would just concentrate on is to make sure there is no harm done, and the support of coenzyme Q10 is really important, and L-carnitine, magnesium, vitamin D, B complex, and low salt diet, of course. Thank you.